Introduction. What is a pod? If an emergency happened in your area, your community might need to receive large amounts of antibiotics or other medical supplies from the federal government. The supplies would be sent to sites that are called Points of Dispensing, or pods. Pods are designed to provide medicine to a large number of people in a short amount of time. Pods can provide either vaccinations or antibiotics. The medication and vaccinations are provided to everyone at no cost. Pods are not intended to provide medical care and are for people without symptoms. If you are feeling ill, please see your medical provider. When is a pod used? Where is it located? A pod would be used during a large disease outbreak, a natural disaster, and emergencies requiring medicine for a large number of people. Pods will be located in your community in safe, familiar places such as schools, community centers, and other large gathering places. What to expect at a pod. Large crowds, waiting in long lines, so be sure to bring any routine medications or mobility equipment that you may need. Police, fire, and security officials. TV, radio, and other media members. Language interpretation services. What to bring to a pod. Water, snack food items to sustain you, eyeglasses, medications that you have to take, the completed name, address, and personal history, or NAF, form. Follow local guidance about what else to bring. NAF form, head of household. When the emergency involves dispensing antibiotics or pills, you will be asked to fill out a form that includes some basic information about your medical history. This is called the name, address, and personal history, or NAF form. This form can be found on your local health department website, or it will be available at the pod. If possible, bring the completed NAF form to the pod. A staff member will review it and determine which medication is best for you. In some cases, you or someone you may trust may be able to pick up antibiotics for family members as well as those who are unable to get to the site. A completed NAF form is required for each person receiving medication. Collect the medical history for each person you are picking up medication for, including medical conditions, allergies, any medicines they are taking, each child's weight. Stations of the pod. The number and type of stations in a pod can vary based on the emergency situation. There are 5 basic stations that you may encounter. Greeting, triage. Here, you are greeted by a pod staff when entering and directed to your next stop. Pod staff at this station ask about symptoms and direct anyone who is sick to medical care. Intake, NAF forms will be distributed here if you did not bring the completed forms with you. Medical screening. At this station, pod staff will review all NAF forms to determine what medication is right for you. Here, any allergies to medication or other health issues will be reviewed. Dispensing. This is where you will receive the medication, as well as instructions about how and when to take it. You will also be informed about how and where to report any bad or adverse reactions that you experience. Education. This station is where you can ask a staff member any additional questions that you may have. Where to get info about a pod. To find out where the nearest pod is located and what you should bring, check your local news station, visit your health department's website and social media, and stay alert for messages from community leaders. What to do now? Fill out the NAF form to be prepared for the pod.